If you enjoyed this podcast, please consider liking, sharing, and subscribing to the channel. The alarming publication. The timing could not have been worse for public health officials. Wakefield's press conference came just as vaccination rates had reached historic highs across Britain. Parents who had dutifully brought their children for routine shots suddenly found themselves questioning everything they had been told about vaccine safety. The study's impact spread far beyond medical journals. Television news programs featured worried mothers holding their unvaccinated children, while newspapers ran headlines asking whether the government had been hiding vaccine dangers. Phone lines at pediatric offices jammed with panicked parents demanding answers their doctors could not yet provide. What made the situation particularly troubling was the study's small size. Just 12 children formed the basis for claims that would affect millions. Yet Wakefield presented his findings with absolute confidence, telling reporters that the evidence clearly showed a connection between the MMR vaccine and autism. Medical experts who tried to urge caution found their voices drowned out by media coverage that treated the link as established fact. Within weeks, vaccination rates began dropping across multiple countries. Parents faced an impossible choice between protecting their children from deadly diseases or risking what they now believed could be permanent developmental damage. The public panic and Mercury concerns. Soon after Wakefield's study made headlines, another concern surfaced that would spread even more fear among parents. This time, the worry focused on thimerosal, a mercury-based preservative that had been used in some vaccines since the 1930s. Parent groups and activists began asking a troubling question. Could mercury from multiple childhood shots be causing autism? The timing seemed suspicious to many families. Autism diagnosis rates were climbing throughout the 1990s, and children were receiving more vaccines than ever before. When parents looked at these two trends happening at the same time, they saw a pattern that demanded answers. What made this concern particularly confusing was that thimerosal had never been used in the MMR vaccine that Wakefield had studied. Yet the mercury theory gained incredible momentum. The fear spread quickly through communities. In the United Kingdom, vaccination rates dropped dramatically from 92% in 1996 to 84% by 2002. Some areas of London saw rates fall as low as 61%. Parents who had once trusted their doctors completely now found themselves torn between medical advice and growing public doubt. Celebrity voices joined the conversation, giving the concerns a much larger platform. Grassroots organizations formed to warn other parents about what they believed were serious vaccine dangers. How could so many people be wrong about something so important? The investigative journalist's discovery. The year 2004 brought a dramatic shift when journalist Brian Deere started asking hard questions about Wakefield's famous study. Working for the Sunday Times, Deere began what would become one of medical journalism's most important investigations. He started by looking at the basic facts everyone had accepted as true. What Deere found shocked even experienced medical professionals. Hidden records showed that Wakefield had received £435,000 from lawyers who wanted to sue vaccine companies. This massive payment had never been mentioned in the original research paper. The money created a clear reason for Wakefield to find problems with vaccines, yet no one reading his study would have known about this connection. But the financial conflict was just the beginning. Deere dug deeper into the medical records of the 12 children featured in Wakefield's study. What he discovered was far worse than hidden payments. The actual hospital records told completely different stories than what appeared in the published research. children described as developing autism after vaccination had actually shown signs of developmental problems before getting their shots. How could such basic facts be wrong? Dear found that some children in the study didn't even have autism diagnoses at all. The Scientific Refutation. The response from the global scientific community was swift and thorough. Researchers across multiple countries began studying hundreds of thousands of children to test whether Wakefield's claims held any truth. In 2002, Danish scientists published results from examining 537,303 children over several years. They found no difference in autism rates between vaccinated and unvaccinated children. Similar studies followed from Finland, Japan, the United States, and Britain. Each investigation involved massive groups of children and reached identical conclusions. Scientists looked at different types of vaccines, different timing schedules, and different combinations. None showed any link to autism. The Institute of Medicine reviewed all available research in 2001 and again in 2004, confirming that vaccines do not cause autism. Meanwhile, genetic research was revealing something important about autism itself. Studies showed that autism spectrum disorders run in families and likely begin before birth. Brain development patterns associated with autism appear during pregnancy, not after vaccination. How could parents make sense of such overwhelming scientific evidence when their fears felt so real? The persistent myth and ongoing consequences. Even after scientists completely destroyed Wakefield's claims and exposed his fraud, the damage had already spread far beyond medical journals. Parents around the world had heard the initial story about vaccines causing autism, and that fear stuck in their minds. When vaccination rates began dropping in country after country, health officials watched in horror as diseases they thought were gone forever started coming back. The numbers tell a shocking story. Between 2007 and 2008, the United Kingdom recorded over 12,000 cases of measles, a disease that had been nearly wiped out through vaccination programs. Hundreds of children ended up in hospitals fighting for their lives. At least 3 children died from measles complications during this outbreak. These were preventable deaths caused by parents who chose not to vaccinate based on false information. Celebrity voices made the problem worse. Famous actors and television personalities began speaking out against vaccines, giving the debunked theory a platform that reached millions of people. Social media allowed these messages to spread faster than scientists could respond with facts. Parents shared frightening stories online, creating communities where vaccine fears grew stronger rather than weaker. Scientists discovered something troubling when they tried to correct the false information. Simply telling people that vaccines don't cause autism often made them believe the myth even more strongly. Researchers call this the backfire effect, when facts actually push people further away from truth rather than closer to it. The verdict: scientific consensus and current understanding. The medical evidence today could not be clearer. 25 years of research across dozens of countries has studied millions of children. Every major health organization in the world, from the CDC to the World Health Organization, has reached the same conclusion. Vaccines do not cause autism. Not sometimes, not in certain children. Never. Scientists now understand that autism begins in the womb, during brain development. The condition has strong genetic roots that start months before any child receives their first vaccine. When researchers compared vaccinated and unvaccinated children in massive studies, autism rates were identical in both groups. The timing was coincidence, not cause. More children receive autism diagnoses today because doctors recognize the signs better. Diagnostic criteria expanded to include milder cases previously missed. Better training helped identify autism in girls and minorities who were often overlooked. This explains the rising numbers without requiring a mysterious epidemic. Meanwhile, real diseases have returned where vaccination rates dropped. Measles cases jumped 79% worldwide between 2022 and 2023, concentrated in communities that avoided vaccines. The fraud that started this fear continues harming children through preventable illnesses.